audible to everyone? Yeah. I'm Dr. Samyak Jain. I'm a practicing neuropsychiatrist in Meerut. And I thank this institution for having this very relevant topic today. So you, as the youth of the country, are the driving force of the country. The youth is the driving force of our country. And fortunately, India is a young country with almost more than 50% of its population below the age of 25 years. So being a young country, this sounds very exciting, as India, being a young country, has a tremendous potential for growth in the decades to come. And our vision, the vision of our government is to make India a developed country by 2147. This engine will be propelled by our youth. So on one hand, it sounds very exciting to have such a youth force, but on the other hand, it has unique challenges of its own. And one of the most critical challenge our society, our country facing today is the grim state of mental health among our youth. According to various evidence-based studies, evidence-based surveys, almost 25% of young and adolescent population suffer from serious mental health disorders in their lifetimes, like mood disorders like depression, bipolarity, anxiety disorders, obsessive compulsive disorders, ADHD, impulse control disorders, body image disturbances, internet addictions, cyber addictions, and disorders of this sort. And most serious are the ever-rising trend in certain conditions like substance abuse and suicidal self-harm, which are at its peak currently. Today, I would particularly like to address about these two things. One is the rising trend and the rampant use of substance among the youngsters. So there is a rampant use acquiring critical proportions, catastrophic proportions among the youths and college and school students abusing substance. Traditionally, alcohol and tobacco in its various forms have been the most commonly abused substances, like opioids and cannabinoids. Cannabinoids in its various forms, like weed, hash, marijuana, is currently available in outside almost all big prestigious schools and colleges in our country, across the country. We all know that all addictions have their initiation in adolescent period. So this adolescent period makes students very vulnerable to fall prey and to become a victim of drug peddlers and drug dealers. And drug dealers and drug peddlers are marketing very hard, to make the use of such substances like weed, marijuana, as normal among the students. I come across so many students and youngsters in my OPD, in my practice, who come with with various psychological disorders because of these substances. And they tell me that they have been told that, okay, this is legal in many countries, this is medicinal, and its use is normal. But the scientific evidence doesn't say so. Scientific evidence says that the substance abuse is the mother of so many serious psychological conditions opioids, cannabinoids, alcohol can lead to serious medical and psychological conditions, including mood disorders and even psychotic disorders. On the other hand, these substances have a dangerous, deleterious effect on overall emotional, psychological, cognitive, and personality development of an entire generation of our youth. So you have to be very cautious, very alert in falling prey to such marketing techniques. And you have to be very cautious in preventing yourself from using any of such substance. Another problem which has acquired epidemic proportions in especially last 1 decade, I would say, is increasing rise in suicide cases among students and youngsters. Sadly, in India, suicide has become the leading cause of death in individuals below 30 years of age, accounting for almost 35% of deaths below the age 30 years, and out of which the highest number of suicide is in the age bracket of 19 to 25 years, which is a very dangerous situation. You must have heard in your day-to-day lives about the suicide of students in various coaching hubs, in various hubs where the students are preparing for competitive exams. What do you think must be the reason behind this? Why there are so many suicides happening of late in the last decade among students? Can anyone come up with a suggestion, or can anyone think of something why it is all-time high currently? Is it examination stress, lot of examination pressure, performance pressure, expectations from the family and the society, and from the teachers also? Is it like changing lifestyles, where people have a certain lifestyle to follow substance, certain lifestyle to comply to, peer pressure, physical and sexual abuse, bullying, cyberbullying, financial constraints, rapid urbanization, cultural changes, lot of social media influences or ill influences, I would say. So all these factors are there which are causing this rampant epidemic increase in number of suicide cases. What we got to do is to become emotionally intelligent, emotionally capable to handle and cope with the pressures of modern day in a more healthy way, in a more emotionally intelligent way, right? So these scenarios of mental health problems, be it mood disorders, be it addictions, be it suicidal self-harm, is not a good trend for a country like us. We need a very mentally, emotionally healthy youth. We need a very emotionally intelligent youth force. We need a very resilient youth force for our country, for especially 2 decades, as we are a young country, to propel the growth engine of the country to become a developed country by 2047. But state of things seems ill right now. It's not good. So what needs to be done? We need to have we got to do a tremendous hard work and a proactive hard work in sensitizing the society, in sensitizing the people at the grassroots to understand the mental health problems, the mental health challenges from at the very inception level. And you know who has the most important role to play in this? The most important role is on the shoulders of the institutions like this, is on the shoulders of the teachers, is on the shoulders of the schools. You know, traditionally in our country, teachers are the most respected people. Teachers are the most respected figures in our society. Our country is traditionally a country of Guru Shishya Parampara. I would say even in this era where the families are broken, where there are a lot of nuclear families, there is no question to the children. Earlier there were like joint families, children used to have a lot of questions in the form of cousins, in the form of uncles, aunties. Now they are living with their parents and mostly both the parents are working. So who is teaching the child? Usually the internet, the social media. Here comes the role of schools and teachers to take up the responsibility of creating awareness and understanding the mental health needs of the students. Schools and teachers have a pivotal role, you know, and I would urge the government to initiate this at the policy level, which government is already initiated also in many forms, but this has to be done at a forefront, at a very proactive level, to indulge schools in taking care of the mental health needs and psychological and emotional challenges among the students. Also, this huge burden of mental illness among our youth is not only disrupting the social architecture. You know, there are so many cases of relationship problem among youth, where the crime is increasing among the youth. You see various cases of crime done by the young kids, you know, of the age 12 years, 13 years. They are killing people ruthlessly. This must be taught by the glorification of crime in the social media and OTT. They are learning from these sources. So, on one hand, this mental illness burden in the form of personality disorder, in the form of other disorders, in the form of substance abuse is distorting the architecture of our society, the very fabric of our society. On the other hand, it is imposing a huge financial and economic burden on our country. There is already so much healthcare gap in our country, and especially in the area of mental health, there is huge gap. You know, we have very scarce mental health resources. There is only less than one psychiatrist per 1 lakh population in India, and the qualified clinical psychologists are even less in number. So here comes our responsibility to prevent mental health conditions at a very early stage rather than treating them at a later stage. And prevention is always better than the cure. So I urge all the schools, all the policy makers, all the concerned players in this context to make talking about mental health a normal issue, a normal thing in the family, a normal thing in the school. Teachers should be sensitized to understand the mental health problem of students at a very early stage. Teachers should address the challenges like stigma. People doesn't want to talk about. We have so many cultural misconceptions in our society. Culturally, we think that having a mental illness is like a sign of weakness or infirmity, or it is a divine curse. But mental health problems are just like any physical health problems, which needs to be addressed scientifically, properly, and it is easy to treat at an early stage, and it will prevent a lot of burden on the country in both terms of healthcare resources and economic resources. So I would again say that schools have a very important pivotal role, and they should start sensitizing teachers. They should be a bridge between the family and the student to talk about mental health challenges normally, to fight stigma, to spread awareness, and to address all such issues at a very early level. So again, we should look for the preventive strategies. We should look to give a healthy environment to the students at schools and in the family, and this would prevent a lot of mental health issues in our youth, and a healthy youth will propel the engine of our country into the new era. Thank you.